Well, welcome back. We're carrying on with the Westminster Hall debate. Now, I just wanted to bring this to you really quite straight, because these MPs have done some really good research, and there was only a few hundred people watching live. Really good points they're bringing out. Monday, the 18th of December was the date of the debate, still the same date. E-petition 635904 relating to the international health regulations that the World Health Organization are currently trying to amend. Now, this is the contribution of Sir John Redwood, MP for Wokingham in Berkshire since 1987, so highly experienced Member of Parliament and well worth listening to. Relatively short contribution, so thank you, Mr. Redwood.
John Redwood.
Thank you. I hope the Minister will listen very carefully to this debate and the petitioners, because I do think it would be a grave error for the government to sign a treaty which gives away important powers over the future conduct of health policy. It is wrong to give to the WHO the sole power to decide when there is an emergency, and it is wrong to give away our powers of self-decision were such an emergency to be visited upon us. We are, of course, members of the WHO, and I think we're all suggesting we continue to be members of the WHO, and we should share our information, we should draw on their research, they will draw on our research and our knowledge from this country, where there is much medical expertise and pharmaceutical company expertise, and together as collaborators we may get to better answers in the future. But it would be quite wrong to vest the power of decision in people so far away from our own country and not in full knowledge of the local circumstances. And I do think before any such power was to be vested in the WHO, there should be a proper inquiry and debate about how they performed over the course of the most recent COVID pandemic. I mean, why, for example, did they seemingly concentrate on vaccines rather than other methods of handling the problem? Why was there a certain delay or difficulty in testing existing drugs that were already past proper safety procedures that might have beneficial or easing effects on those who got the condition? Why was there not more work on ultraviolet use behind the scenes in airflow systems to clean up the air when it was circulating? Why wasn't there more consideration of isolation hospital and isolation health centres? Unfortunately, quite a lot of the disease was spread through health areas, so that other health matters could be continued during the course of COVID treatment without so much cross-contamination within general hospitals. Why wasn't there recommendation and advice on isolation? Why wasn't there more careful consideration of whether it would be better to concentrate on making sure that those who were most vulnerable were protected from the presence of the disease as much as could be possible, rather than trying to lock down whole populations and then having to make exemptions so that we could keep the lights on and so that some food could be delivered to people's homes, because there was something rather arbitrary about who was allowed to go to work and who wasn't allowed to go to work. Why wasn't more work done by the WHO on cleaning up the data? Because we were given comparisons between countries, but if you look beneath the data, you discovered that they were using very different definitions of what a COVID death was, and there were often very great difficulties in individual countries under the impact of the wave of the disease in actually carrying out proper diagnosis of whether someone really did have COVID or whether there were other medical problems that the person was suffering from that was more likely to have caused the disease. Some countries took a very tough line, saying anybody with COVID died with COVID, although they had lots of other conditions. And so they had big figures, and other countries took a rather narrow view and said, well, this person was in their mid-80s, they were suffering from a number of other conditions which might have led to the difficulty.
Share my concerns that the WHO refused to even have any review of the recommendations they gave out during the COVID-19 pandemic. So sure are they that their advice and the recommendations were absolutely perfect. And that can only mean that if we sign up to these instruments, we're going to get more of the same.
Well, that is one of my worries. I do think we need more transparency, more debate, more discussion and more challenge of those in these well-paid positions at the WHO. so that science can advance. Because as I understand scientific method, it isn't choosing a limited number of scientists and believing everything they say. It is having a population of talented and able scientists who challenge each other, because then you get more truth out of the challenge and exchange of ideas. You don't want an international body saying there's only one way to look at this problem or to think about it. You do need that process, a challenge, and you need it to be an accelerated process, a challenge when you have an urgent and immediate need of better medicines, better vaccines, better procedures, better approaches to lockdown or non-lockdown. And surely that is the time for healthy debate, constant review, and sufficient humility by all of us who venture opinions on this, because time and the events could disprove them very quickly. And if they do, then you should learn from that process and be honest about it, rather than saying you were right all along and there was only one way of approaching it. So that's all I wish to say, really, that I think we need much more accountability, much more exposure, much more proper debate, that by all means the WHO can make an important contribution, and it can be a forum for scientists and pharmaceutical companies and others who will be part of the solution should we get some future wave of infection. But please, government, don't trust them with everything. Don't mean that future ministers are not able to act responsibly and well in response to public opinion and to medical opinion within our own country. Do not sell us short, because that would also sell the world short, because this country has a lot to offer in these fields, and it will be best if it allows open debate, proper review and serious challenge.